on the program. There's a group called Sustain out of the UK that is working for better hospital food, better food served to patients. And with Sustain is Alex Jackson, who joins us in the studio right now. Hello, Alex.
Hi, thanks for having me.
Thanks for coming in. Welcome. You've been in Canada for a while now, haven't you?
I've been here for a week, yep, and I'm here for 10 days.
And talking about Sustain to various groups?
Yeah, absolutely. So we're running a campaign in England called the Campaign for Better Hospital Food. Quality of hospital food in England is atrocious. It's a sort of cause of national shame, really. It's often unhealthy, it's unappetizing, a lot of it's wasted, and it's produced the lowest standards of production. And we're beginning to see a similar trend to that in Ontario. A lot of hospital kitchens are being closed, hospitals are being built without kitchens, a lot of the food is heavily processed and sort of ready meals. So it seems to be that the Ontarian hospitals are going down the same route as we've gone down in England, and one of the reasons I'm here is to help Ochu, which is the Ontario Council of Hospital Unions, to get people to get behind their campaign to save hospital kitchens and improve the quality of meals served to patients.
Is part of the problem just the expense of health care, and maybe that's a cut people can make at a hospital? They think they can cut out the kitchen and contract out food supply or whatever?
It is used as an excuse. I think some hospitals think that by closing a kitchen, buying in ready meals, reducing the quality of meals is often a repercussion of that, and they think they'll save money that way. But actually, the statistics in England show that where you take out a hospital's kitchen, where you buy in ready meals, actually over the long term you pay more for it. And what's even more disappointing is it stops hospitals from striking up relationships with local suppliers, buying local food from Ontarian farmers, which can invest a huge amount of public money in local farmers, which is a missed opportunity. So the cost argument is often offered as a reason why this can't, hospital food can't be good. But as you've shown, as the St. Catharines has shown, that doesn't have to be the case.
Well, the kitchen at the new hospital and the food at the new hospital is getting pretty good reviews so far. So
I've heard it's excellent,
right.
And I've heard that the hospital prepares and cooks food freshly on site. That the hospital is aiming to buy more local food, more food from local farmers, again, which is an excellent thing. So really, it's good news for St. Catharines. They're leading by example.
Now, and you don't have to out anybody necessarily, but you were telling me that you've been to London, Guelph, Kingston. You've been to quite a few communities in Ontario so far. Is there somebody that's not doing that? Are there examples of horrible food and this awful trend that you're talking about?
I've been told that in Ontario, in general, about 30% of hospitals are reliant on ready meals, only buying ready meals. Right. And we've been to a number of places. There are some towns doing less well. So Hamilton's not doing so well, and Peterborough's not doing so well, and it's no coincidence that at those hospitals they're buying in these ready meals. So there is a trend towards going down the ready meal route, and there's a campaign starting here in Ontario to stop that and reverse the tide and get fresh food back in our wards.
Well, good. Now, a lot of people will say, listen, you're not at the hospital to dine out. As long as you get something at the end of the day or whatever, that's fine, and that should be all that's required. How would you respond to that? Is this food actually unhealthy for people? Is that part of the problem?
Well, in England we get told that we should have low expectations for hospital food.
Right,
Why should we expect it to be nice? But actually, we spend a massive amount of money and taxpayers' money on hospital food, and the problem is we're not getting value for that money. And I bet you anything, in the areas where the hospital food is bad, that hospital patients are having to, the families of hospital patients are having to bring them food. They're having to pay for food to bring them in order for them to get some adequate nourishment. So in a way, they're paying twice. They're paying once through their taxes, and they're paying again for food when their relatives in hospital. So there's a real value for money issue there, and it's such a shame because good hospital food does not have to cost much, and it can do a huge amount to lift morale of patients, help them recover, and to help local farmers too. So it can be a win-win.
Now, you mentioned, or perhaps I read this ahead of your visit, the amount of food that's wasted in the UK that's right there a testament to change the system, I think.
Yeah, I mean, it's an extraordinary amount of waste. We waste up to 70% of our meals, which means that 70% of meals just go directly from the kitchen to the bin, essentially, which costs money. It costs money to get rid of food. And obviously disposing of it causes environmental damage and et cetera, et cetera. So I think the waste issue is probably one of the clearest signals that the food's not good enough. And I think Ontarian hospitals should audit the amount of food that they waste to see whether they, to see whether they got a similar sort of problem.
A lot of the prepackaged meals, and again, there's different suppliers. I understand that, but I find a lot of processed food is high in either sodium or sugar or both. That's the price you pay for getting processed food, and that's just not healthy.
It's not. I mean, the sort of things we're calling for in England are just sensible nutritional standards. It's only sensible that hospital food shouldn't be packed full of saturated fat and salt, because that's contributing to the sorts of diseases which is putting people into hospital in the first place. But aside from that, hospital food can be made with ingredients which have been lovingly grown in Ontario,
right.
and there's lots of and the way that we produce and consume food in general in the world it has caused environmental damage. So if we improve the way we improve food, then we can tackle things like climate change. So food is really, really important. It plays a big part in our lives in more ways than we recognise.
So is this the model then? Keep the kitchen, cook the food, health levels of healthy levels of saturated fat, sodium, things like that. Buy local. Is that kind of the model that you're talking about?
So. I think if I was and I'm not from Ontario, but if I was, and I'm reluctant to get into a political debate, but if I was an Ontarian citizen, I would want to see my hospitals cooking fresh food on site. But I'd also want my political leaders to set standards for patient meals, to make sure that we're all getting nutritious, healthy, popular meals, which people in St. Catharines seem to be getting. Why can't every citizen in Ontario get the same quality of food? So that's what I'd be pushing for if I was a local.
Right. And this program, the Sustain program and the push, how is the initiative going so far?
Yeah, we've had a tough 2 years because government is very opposed to improving hospital food for some of the reasons you mentioned earlier. But we're beginning to make headway, and the reason we're beginning to make headway is because we've got a huge amount of public support behind us, and we've pushed the government into providing extra funding, for example, for hospitals which are serving better food, and changing some of the ways that they write their contracts in order to build in these sorts of standards. But really, one thing I should mention Ochu, the Ontario Council of Hospital Unions, is doing is it set up a patient hotline for people to write into them to tell them what their patient experience has been in terms of the food, whether they've liked the food, to send them their photos so that Ochu can get a better idea of what's being served. So if people wanted to do that, the email address is admin@ochu.on.ca.
All right, and you are speaking in a few minutes at the hospital?
That's right, yeah. That's correct. So we'll be going there, and really it's an easy one because we'll be saying, well done, pat on the back, you're obviously doing a good job. So it's nice to make those sorts of visits.
Wow, and I appreciate you coming in the studio as well, Alex. Good luck with the initiative.
Thank you so much. Thanks.
All right, from Sustain, and speaking at the hospital here at 2 o'clock, Alex Jackson, and we are also in the middle of Ontario Local Food Week, so there's a lot of reasons. And if you want to look up the Ontario Council of Hospital Unions, and you're just calling it Ochu, is that right? Ochu or Ochu? How do I say that?
Ochu.
Ochu. Then you can find out how to get involved in the campaign.